Yeah, Bev, it's looking pretty likely. There are now a couple of Hong Kong media outlets that tend to have decent government connections reporting that a lockdown featuring stay-at-home orders will be put in place this month during a compulsory testing period. So if you're wondering why Hong Kong is getting so much focus, given that COVID is pretty much endemic everywhere now, it's because Hong Kong is this incredible experiment. Yesterday they clocked about 35,000 new daily cases, yet the Chinese government still officially is pursuing a zero tolerance, zero cases policy in the city. So we've never seen anything like this before, trying to go from something like 35,000 a day down to zero. We've seen in mainland China much smaller outbreaks be reversed, but the scale of the challenge for authorities both in the Chinese government and in Hong Kong is huge. And the news today, not confirmed yet by Hong Kong's government, is that a lockdown with stay-at-home orders, very similar to what we had in Sydney and Melbourne, where you can still go out to buy groceries and things like that, that is likely to be imposed over at least a 9-day period this month. And during those 9 days, they will try and test all 7 million residents of Hong Kong 3 times each. Bev?
That is extraordinary, Bill, and such an undertaking. What sort of pressure is that building on the health system, given those case numbers and then that push to get all those all that testing through?
Well, an absolute huge burden on the health system. We've seen some not particularly nice photos circulating from Hong Kong taken by doctors and nurses who work in hospitals there of body bags being left on gurneys outside accident and emergency rooms. The reason why they're sort of being stored there is because the mortuaries and the other facilities for storing body bags in the city are now at maximum capacity. And also, too, the COVID wave has affected the ability of workers in that particular sector, in the health sector, to transport those bodies. So pretty grim scenes we're now witnessing from Hong Kong. These are the sorts of things, of course, other cities in the world have gone through at various stages during this outbreak. But it's happening now in Hong Kong because the city has been pursuing a zero cases policy for 2 whole years. And as part of the zero cases policy, before this most recent outbreak, anybody who tested positive to COVID in the city had to be hospitalised. Those were the rules. So you still have this backlog in the hospital system of people who don't have particularly severe infections. And for that reason, the capacity problems in the hospitals, Bev, have just been exacerbated by this COVID zero policy. So, of course, they've now had to loosen many of those requirements. People are allowed to isolate at home. But it really is a situation where both there is a huge number of cases and there are huge and very restrictive rules in place.
Well, with this Omicron variant that is just so contagious, most countries have pulled back from this notion that you can keep to that zero case policy. Is this likely to keep on going in both Hong Kong and China?
Yeah, Bev, we saw a little snippet today from one Chinese government health expert suggesting in a written article that at some point in future the COVID zero policies of China and the living with the virus policies of the rest of the world will likely merge. So some people were sort of suggesting that maybe this is early signalling that the Chinese government is sort of softening up the population to accept the idea at some point of living with the virus. But other China watchers came out and said, don't jump to conclusions. Remember, Xi Jinping has the 20th Party Congress at the end of this year. He's going for an unprecedented 3rd term as the Chinese president, as the Chinese communist leader. Highly unlikely, most people think, that he would allow COVID to circulate inside the mainland this year before then. However, Hong Kong, rather different situation. The key thing here, Bev, is that Xi Jinping is due to travel to Hong Kong in July to mark the 25th anniversary of the handover. Remember that it's supposed to be 50 years of one country, two systems. They're now at the halfway mark, so everybody assumes he will travel to Hong Kong for that. And at the moment, the assumption is, despite the huge numbers of cases in Hong Kong, local officials there will still be under pressure from Beijing to get it to zero or get it near zero before Xi Jinping turns up.
Extraordinary pressure. Bill, great to talk. Thanks so much.